Welcome to the Bio and Beyond podcast. I'm your host, Sawik Nath, and today we're diving into the world of public health data, surveillance, and technology. Please join me in welcoming our distinguished guest, Dr. Jennifer Layden. She is a director for the Office of Public Health Data, Surveillance, and Technology. In this position, she is responsible for leading, coordinating, and executing a comprehensive public health data strategy and improving the availability and use of public health data to inform decision-making and action. She provides leadership for CDC's Data Modernization Initiative and serves as an advisor to the CDC Director. Without further delay, let's dive right in. So why don't you tell us a little bit about yourself?
Great. Sure. Happy to, and great to be here. And thanks for hosting the event. So myself, I have been at CDC. I'm a physician by training, an infectious disease doctor, but I also studied and pursued a graduate degree in epidemiology. I've worked in clinical medicine and what we call academic medicine and research, and worked more in the public health practice space starting maybe about a decade ago. My journey to public health really started with my interest in understanding how to make a big impact in helping individuals, community populations, and looking at it from the lens of how we can use data, how we can use information to stop the spread of the disease. As an infectious disease physician, so much of what I would see was due to continued spread of diseases, and there's ways to prevent that, multiple different ways to prevent that or stop that transmission, whether it's vaccines or other type of interventions, treatment sometimes, and the ability to impact that and save lives, shut down outbreaks when they occur, or identify the source of the outbreak. I found fascinating in data and data and information being key and core to identifying those outbreaks was really what pursued me, not just to public health, but the field of public health data.
That's really interesting. So what happened when you were younger that really made you want to do what you do today?
That's a good question. So in high school, I always thought I would be a physician, a doctor. Went to college, did pre-med, and was about to go right to medical school out of undergraduate, and then all of a sudden realized that maybe I did not want to be a doctor. So took a little bit of time, taught high school, chemistry and biology actually. But after a few years of that, realized that I did want to go and pursue medicine. When I was in medical school, I became involved in research and really became interested in the use of data, modeling with data, conducting statistical analyses to understand problems. So as I was in medical school, decided to pursue the combined degree, so to get that PhD in epidemiology. In that, from the experience of doing that coursework, more importantly, being involved early in the research and seeing the possibility and the impact of it motivated that. And I think one of the lessons I would say was the ability to keep an open mind and to take advantage of opportunities. I don't think I would have gone into public health if I had not done a summer internship in research and being able to really understand and see how data was used to answer questions.
That's really interesting. I always love learning about people's experiences into getting into their fields. So why don't you tell us a little bit about the data that you collect at the CDC? Where do you get it from? How large is it and who uses it?
Yeah, so data is very complicated in public health. Data is really core to what we do. In clinical medicine, treating patients, you use data and information to make decisions of how you're going to treat the patient, your recommendation about a medicine, a recommendation of guidance you give that patient to, for example, keep their blood pressure under control. In public health, the use of the data and information is different. So in public health, our focus is on identifying new diseases, new public health threats. So whether it's a novel flu or, for example, when COVID hit, identifying and seeing that there's a new pathogen. And then when that pathogen or disease happens, being able to track or identify how many cases there are. And then if the cases, there's a lot of individuals who are sick, understanding how they're getting it. And then when you understand how they're getting it, understanding what you can do to prevent the transmission to others. So we use data at all levels of public health. CDC's what I'd call the federal level. So it looks across the nation. And then we have public health practice at the state level and the local level. So the local would be at your community level, city level. Each of those roles of public health has a different role. At the local level, they have that responsibility of when there is an outbreak in their community, doing what they can to identify the source. And that relies on data. So how many cases there are of a foodborne outbreak, where those cases are getting sick, what they ate. That's the information they use to identify the outbreak, identify the source, and then shut down that source. At the national level, we look at it from a bit of a broader perspective. So we may not be the ones who are in the local community stopping the spread of a disease, but we are looking at data at a nationwide level to identify trends in disease burden. For example, are we seeing more opioid overdoses, right? And in which communities, so that we can then work with those communities to ensure that they're aware of it and can intervene. We use that data to identify outbreaks or diseases that are occurring across jurisdictions. So sometimes you have outbreaks, COVID was an example where cases are occurring everywhere, right? And that one jurisdiction, that one state could identify that. So at the national level, we look at the trends that are occurring nationwide, as well as trends that tell us the severity of a public health threat. For example, going into summer months, there's, will be illnesses and public health outcomes related to heat, right? As heat gets severe, people have heat-related illnesses. They need certain types of services. And so we will monitor different types of information. We'll look at information about individuals coming into the emergency rooms. In urgent cares, we'll look at how busy our hospitals are. So this information helps us to understand the nationwide trends and then work with and support our local partners to intervene when there are concerning public health threats.
That's really interesting. So you get this data from the hospitals?
Some of it, yeah. So some of it in public health, there's at the state level, there's certain things that they are required to report to the state health departments. The national level, that doesn't happen, but we work with our state partners, so we get data, but not identifiable information. So there's ways that we can get the data on, for example, who's coming into the emergency room without knowing who those individuals are, right? But it helps us to identify if there's concerning trends happening somewhere due to heat-related illnesses, or if there were, as we just had in the last few weeks, a novel influenza. As that was identified, what we wanted to do was to make sure we were not seeing any other signals anywhere else in the country of individuals who might also have that novel influenza. So we have mechanisms working with our state partners to look at such data in a way that's not identifiable. Other types of data we get and are used across public health include what we call more vital statistics data. So data about births and deaths, so we can understand overarching population trends of how big the population are, and if we're seeing a rise or change in the number of deaths, for example, due to cancer or other conditions. We receive information sometimes from different types of surveys, where there may be survey and information collected on individuals with certain conditions, and we want to understand risk factors for those conditions or complications from those conditions. And so there may be direct collecting of that information from individuals. So sometimes it's hospitals, sometimes it's information about labs like lab testing. And then there's data that comes in from asking patients or individuals questions to understand different types of trends.
Well, what would you say was the most interesting thing that you have done, and what would also be the most challenging thing that you've done?
Yeah, it's a great question. The great thing about public health work is that it's always exciting and it's always changing. And you get to work with a lot of great people with multiple different types of expertise and experiences. Before coming to the CDC, I worked in public health at the state level. And in that role, I would oversee a lot of different outbreak investigations. And when I was in Illinois, one of the outbreaks that we had that became a major issue was something called E-Valley or electronic, it was vaping lung injury. So individuals, teens, young adults were getting severely ill. They were getting what looked like pneumonia of the lungs, but so severe that they were having a hard time breathing, would have to go to the hospital to get significant treatment. What was happening, and no one at the time, no one knew what was causing these young, otherwise healthy individuals to end up coming to the hospital so sick that they had to stay in the hospital, sometimes so sick they had to get actually help with their breathing, and in some instances either passed away or had to have lung transplants. And so we had cases in Illinois as well as surrounding states and eventually in many parts of the country, and we had to figure out what was causing it. So there was a series of talking to the patients, talking to their families to understand what they were exposed to, and what we found in those interviews, and then ultimately with collecting some of the content that they were vaping, was that individuals were getting sick from contaminated vaping material. So this was vaping material that had contaminated THC. It was contaminated because of the type of substances they were using to supplement the THC. And it was something called vitamin E acetate. And by having that in there, and these were all illicitly made or legally made products, individuals would smoke this and then become really, really, really sick. So being able to, one, pick up a signal that there was something unusual happening, and then two, identify the cause. And by identifying the cause, that stopped further cases, because as soon as it was identified that it was in vaping materials, there was efforts to take those products off of the market. So that was an example of like a real time being able to investigate and then stop further cases because of the work of the team that did that investigation. As far as a challenging, certainly anyone who worked in public health during COVID felt a lot of challenges. It was a very stressful time, just as it was for people working in hospitals and clinical settings. But just the overwhelming amount of work that was needed to support the communities, to provide information. Everyone wanted information about how many cases there were, how busy the hospitals were. So we had to collect that data and be able to share it back immediately, but do it in a way that people, no matter how much data and information we were able to share, there was always more questions. And to collect that data, it was at a time where the ways that we collected that data and information, we did not have good tools to do that. So we had to actually, while collecting data, also build new tools and products to be able to better capture that data and better share that information out. So we are essentially in the boat while we were trying to build the boat, right? You're collecting the data, you're responding, but also knowing that you don't have all the tools that you need to do your job. And so we were having to build those tools during what was a very severe pandemic.
Mhm. Well, that's really interesting. So, as a leader in public health, what are some strategies that you employ to communicate complex health information effectively to the public?
Yeah, so great question. It's hard. Communication is a very important role that we play. Ian is one of our communication leaders in our office. And as I have worked at multiple levels of public health, I've always emphasized that having a really strong, great communication team is really important. It's sometimes presenting information that is challenging or complicated, and you want to make sure that you present that information in a way that people can understand, but also understand it in a way that is meaningful for them to make decisions. And sometimes that means presenting it in multiple different ways, because what is useful information or useful ways for someone to receive information may vary, whether you're an individual running a school, if you're a parent with a young child, if you're a younger individual versus someone who's older or works in the field, what you need as far as information may vary. So one strategy I think that's been really important, and something that I think is we're continuing to see great improvements in public health, is ensuring that we are sharing as much information as we can in ways that people can understand and inform their risk of disease or threats. So, we don't always, everyone has personal family decisions to make, but it's our job to ensure that we can get them information that is meaningful and understandable so that they can understand what a risk might be to them, and use that information to then make a decision. Do I want to travel to an area where there's a major outbreak? What do I do if I'm in that area? Who should I call? When should I go to see a clinician if I'm having symptoms? So that strategy of identifying who the audience is or audiences are that are needing that information, and then figuring out what is information that they need to help inform their decisions is challenging, but I think an important strategy when you're communicating or trying to identify what to communicate.
So, what qualities and skills would you say are needed for a career in public health data and technology?
Yeah, so a lot of skills and qualities. So we, in public health, there's all different types of positions. And that's one of the great things about public health, is that you do need individuals with different skill sets, different experiences, different expertise. In our office, we are with the Office of Public Health Data Surveillance and Technology. So we don't necessarily focus on one specific disease, but we focus on building tools and solutions to enable use of data for folks across public health. So we have individuals who are come from the technology field. So they've learned and worked in the private sector and actually built technical solutions. We have people who are what we call human-centered designers. So they come from the design field and know the process to build a tool or a solution, technology solution, in the mindset of what is the end user of that, or what does the customer need. So we have that total skill set. We have people that have worked in public health, so they understand what the needs, challenges are of people who've worked at all levels. We have people who are clinicians, whether that's a physician, a nurse, a pharmacist, but understand some of the clinical sides of medicine, because that skill set and expertise is important. We have statisticians, so people who, or statisticians and data scientists, so people who understand how to run analyses on data and find signals in data, sometimes a lot of data, or work with large data sets. And then we have communicators. We have people who come in with policy expertise, so people who understand how to take some of the policy levers and use that to support the work that we do in public health. So the great thing is the range of skills and expertise are very, very broad, and in many ways increasing as the role of technology and technical approaches are becoming much more important for the type of work that we do.
So, what advice would you give to high school students who are interested in pursuing a career in healthcare related to data and technology?
It's a great question. Maybe a couple things. One is keep an open mind, in that there's so many different ways to get into the field, and what you may think of as the only way to do it or the only type of healthcare you want to do may change over time. So always keeping an open mind. To being inquisitive. So asking questions, whether it's of your teachers, your professors, or people that that work in the field. So asking them how they, just as you're doing, how they got into the field, what the challenges they faced on their path forward, and then pursuing opportunities that may sometimes seem like really small opportunities, whether it's an internship, to shadow someone, to go to a conference. All of those unique opportunities open doors that you may not even be aware of. There's so many opportunities out there. There's so many different ways to get into healthcare, public health, data and technology. And every time you explore something or talk to someone, it opens a door. So taking advantage of all those opportunities to learn and being exposed to the wide range of those opportunities.
Is there anything else you would like to add before we end?
Just to say, that data technology are growing fields. They are ever present. What's great about public health and healthcare is it's really meaningful work. Meaning you're doing things that save lives. You're doing things that identify, prevent outbreaks. You get to work with people with very different skill sets and expertise. And so, the power and opportunities with data and technology skills is vast. And then being able to apply it to areas where you can be making meaningful impact on individuals and communities' lives and well-being is really rewarding.
Okay. Well, as we wrap up this insightful episode of the Bio and Beyond podcast, I want to extend our sincere gratitude to Dr. Layden for sharing her wealth of knowledge and expertise. Her commitment to the field of public health and technology is truly inspiring. Stay tuned for more captivating conversations at the intersection of biology, medicine, and technology. Until next time, this is Sawagnat signing off from Bio and Beyond. Remember, the exploration never ends. There's always more to discover.